Hi everyone, my name is Sean Bansmer and I am a graduate student with the Wisconsin Lutheran College. So my presentation, I will discuss the background, causes, and strategies surrounding traumatic brain injury. While TBI can affect anyone at any age, I will focus on students and the impact on their education. What is a traumatic brain injury? The Center for Disease Control and Prevention defines a traumatic brain injury as disruption in the normal function of the brain that can be caused by a bump, a blow, or a jolt to the head, or a penetrating head injury. Traumatic brain injury, or TBI, is an insult to the brain, not of a degenerative or congenital nature, but caused by an external force that may produce a diminished, altered state of consciousness, which results in an impairment of cognitive abilities or physical functioning. Students who have experienced a TBI or concussion may have diverse range of physical, cognitive, behavioral, and social needs. Collectively, the students, their families, the teachers, and administration must collaborate to ensure the student receives support necessary to be successful in the classroom. TBI, the silent epidemic. Quite often, traumatic brain injury is referred to as the silent epidemic because it is invisible. It remains a major unrecognized public health issue in the United States. You cannot see a brain injury, therefore it remains invisible to observers. Minor blows to the head, for example, kids messing around and they bump their heads, are not perceived as brain injuries. It's just kids being kids. Something that you need to lose consciousness to have a brain injury. That is entirely not true. Some TBI effects. Traumatic brain injuries can affect all levels of society at all ages. While recovery can reach 90% of those suffering from TBI, long-term recovery may reach 25% of those affected. In fact, 2% of Americans' life with TBI-related injuries, sometimes resulting in emotional and cognitive issues. Levels of TBI. There's 3 levels. There's mild, moderate, and severe. The Glasgow Coma Scale, or GCS, is the most common scoring system used to describe the level of consciousness in a person following a traumatic brain injury. It is used to help gauge the severity of the injury. The lower the score, the more severe the injury. As time progresses after TBI, a Glasgow Coma score should increase as functionality improves. At-risk groups. At-risk groups include a higher rate of males over females when it comes to TBIs. The highest rate of injuries are ages 15 to 24 years old. Why is this? Is it because boys are greater risk takers than girls? Perhaps. Are their activities more aggressive than that of their counterparts? Quite possibly. Other high-risk age groups are those children under 5 years of age from falls, shaken baby syndrome, etc. And also the elderly, lower level of balance, accidents, and etc. Leading causes of TBI. The most common cause of traumatic brain injuries are by car accidents, by both being in a car and or being hit by a car. Sports and recreation range from amateur to professional sports, as well as weekend athletes and kids on playgrounds. Other causes include physical abuse, including shaken baby syndrome. Victims of domestic violence are included in other. Firearms and falls that include blows to the head, strangulation, being pushed into a door, and even near drowning. Traumatic brain injury is... A traumatic brain injury can be caused by the following. 1. An impact to the head causes the brain to move. For example, a baseball catcher gets hit with a bat. 2. A direct blow to the head. An example of this is that of a football player. As an athlete who has played as a running back from grade 6 through college, I was subjected to many hits to the head, not always legal. I sustained countless direct blows to my head after getting hit by defensive players. And number 3, rapid acceleration of the head, typically caused by a car accident, falls downstairs, or shaken baby syndrome. Traumatic brain injury is not. Traumatic brain injury is not an onset mental disorder, nor is it caused by emotional stress or mental retardation. The misconceptions of how traumatic brain injury is seen runs the gamut of misnomers. Concussion symptoms. A concussion is a clinical syndrome characterized by immediate and transient alteration in the brain function, including alteration of mental status and level of consciousness, resulting from mechanical force or trauma. Traumatic brain injuries and concussions go hand in hand. Some examples are prolonged headaches, nausea, vomiting, sensitivity to light, and sleep disturbances are all symptoms of concussions. Post-concussion syndrome. Post-concussion can last for weeks or even months. Memory problems, mood swings, and drowsiness are all symptoms of prolonged downtime. Patients should avoid activities that put them at risk for repeated concussions. When it comes to student athletes at a high school and college level, protocol states that they take a baseline concussion test and must pass repeated tests before they are able to complete them again. Rest over time is what will heal the brain after concussion. Risk of repeat brain injuries. Individuals who sustain multiple brain injuries are more likely to sustain additional injuries. Each time the head is hit, injuries accumulate. In theory, several factors in why injuries increase. Reaction time is slower, judgmental, it can be impaired, more impulsive, and they're not really paying attention. What changes might occur as a result of TBI? TBIs can change in cognition and learning, social or emotional, and behavioral changes, as well as physical or sensory changes. Cognitive and learning changes include changes in reading and math skills, memory retention, and organization. Social skills are affected by anxiety, impulsivity, and vulnerability. And physical or sensory changes can include vision issues, lack of motor skills, and speech production. Thinking changes. Reduced attention to processing speed are two common thinking changes after a traumatic brain injury. Attention problems include difficulty concentrating, paying attention to details, or being able to multitask. Actions will slow, almost as if they are in slow motion. Continuing with thinking changes, individuals may complain about changes in how they communicate. They are often unable to come up with the right words to convey their messages. Trying to stay organized can also be difficult. Information before the injury will remain intact or untouched. Learning new skills and retaining that information will be difficult at best. Rules for teaching students with TBI. So I'd like to share a story about Kelly Boudlin. Kelly's a victim of a dramatic brain injury. In 1992, she was a passenger in a car that hit a telephone pole, which left her with a TBI. At the time, she was 15 and was extremely active. She was a cheerleader, an artist, and an equestrian. She also excelled in her classes and was included in the Duke University Talent Identification Program while still in the 8th grade. She had an incredible life at her fingertips. After the accident, she was in a coma, and when she finally awoke, she was unable to speak or walk. In her words, she said, "Such a charmed life I led as I dreamed of a career in trail law. One accident that nearly took her life wiped it all away. For years she suffered with double vision. No teacher recognized the signs. In 2005, at the age of 27, she was a graduate school student in the field of learning disabled education. It took her years to recover, though she is still not 100%. Some tips she shares include learn what the student knows, expect uneven emotions, show compassion, see the student behind the behaviors, realize the importance of English teachers, and finally, seek out the potential of TBI students. Be patient, transition plans for students, structure and routines, allow leeway in expectations, be supportive and responsive to the students in changing needs. Post-TBI strategies, attention and alertness. Several strategies for helping students heal are as follows. For attention and alertness, deficits include falling asleep during class or being unable to focus on a task at hand. Accommodations can be made for the students by shortening their assignments, providing additional breaks, and minimizing distractions. Post-TBI strategies for visual perception. Visual perception deficits include omitting portions of reading material or walking in the hallway bumping into people. Accommodations can be made by providing peer support reading or allowing extra time between classes. Post-TBI strategies, memory and new learning. Memory and new learning strategies are deficits are when students cannot recall events from previous day or they forget rules. Accommodations can be made by providing a daily schedule and review the routines of the class with the student, and a post list of the rules in the classroom for a student to see. Post-TBI strategies with written expression. When it comes to written expression, students may be unable to write legibly or make a simple organizational errors. Accommodations can be made by reducing the amount of time written work that student has to do or encouraging them to use spell checker software on assignments. Additional categories: speed and processing, verbal expression, social, behavior and emotion, and physical. Additional strategies include speed of processing, social and behavior, and emotion. Educators must understand why they need to take each day as it comes. As the brain heals, the student's abilities will change. By providing a structured setting with routines and flexibility in instruction, the student will continue to make headway during recovery. Concessions need to be taken not only in school, but how the student interacts at home. By having a team approach, including teaching staff, administration, and family, the student will be better equipped to tackle each day. Prevention in schools. When it comes to preventing traumatic brain injuries at the school level, review playground safety and school bus safety with the students. Encourage them to sit properly on the bus to avoid falls. For athletes, ensure the coaching staff is preparing the students during practice. All too often, kids are being hurt during practice, not necessarily games. By giving them the proper gear and the proper training, some injuries may be preventable. In relation to violence in schools, teach the children to be safe and implement a no-tolerance policy for violence, whether it be bullying, fist fights, or violence that escalates. Show the students there are consequences for their actions. While it is hard to determine if an outside party comes in and tries to unleash violence in schools, try to encourage the students while they are to be safe. So my final thoughts: all in all, a traumatic brain injury may not be a life sentence. There are varying degrees, and over time, with the proper support, TBI sufferers can heal. Teachers need to work not only with their students and family,
I don't know that one.
With the student and family, but with administration and their other students as well. While it is hard to convey to an entire class why one person may get special treatment, it is for a greater good. As an educator, you will likely get by in from your class. They will be there to help your students suffering with TBI get through their day-to-day activities as a whole. The entire class will be better from it. Thank you again.